Hi, my name's Roger. I'm 38 years old. It's October 16th, 2014, and back in January of this year, I was snowboarding and caught an edge and fell on my left side. Not a very hard fall. I've fallen much harder and going much faster than I was, but it was just the angle. The snow went from basically the side of my head down to the very top corner of my left shoulder and stretched it out. I mean, it tweaked it pretty hard. But again, I wasn't going very fast or falling very hard. It was just the angle of it. And it caused a shoulder separation. That's different from a dislocation. So the shoulder joint is totally fine. It didn't pop out. I didn't have to pop it back in or anything like that. That would be a shoulder dislocation. Mine was a separation, which is the collarbone or clavicle, which runs from where my thumb is here until maybe about there. When I drop my shoulder, it's basically to the end of the shoulder. When I sit up perfectly straight, it's, maybe a couple inches from the end of my shoulder, but that's the bone. I mean, it's a good, 7-inch bone or so. So it's a long one. And it turns out, I didn't know this, I didn't know how easily this could be injured, the clavicle, but it turns out it's only held down by a couple small ligament fibers. One is the CC joint, and there are a couple actual fiber groups. I think one goes kind of like this from the clavicle, holding it down to the whatever C bone is down there. And then another one that kind of goes at this angle, I think. And then there's the AC joint, which connects the acrocrove something, the A joint. So that connects the clavicle to whatever this A bone is here. And that's a small one. It's basically the tip of your clavicle and connects to your shoulder. And it's a very small ligament group as well. So when I landed and it forced the shoulder down, the clavicle kind of stayed put. All those ligaments popped. So I think it's a complete tear. So let me show you. I'm at work, so I'm not going to keep my shirt off too long, but basically, it's pretty nasty here. You can see what a normal one looks like here. So when I lower my shoulder, push it forward, the clavicle moves with the shoulder. You can see it sticking out a little bit, but that's normal. It's held down at the AC joint here, and then again, the small ligament fibers that connect it along the length of the bone, and then it goes to the middle here. Now this left one here, if I drop my shoulder or push my shoulder forward, you can see the clavicle just doesn't travel with it. It's separated completely. But the good news is, so that's the injury. Looks kind of ugly. But the good news is I have full use of my arm. I really haven't had too many problems. A couple weeks of pain following the injury, but really haven't had too many problems. I can do push-ups, pull-ups. I can swim. It's a little uncomfortable. When I lift my arm up, which I can do fine, there's a little bit of grinding and a little bit of, not really clicking, but the bones are kind of grinding and it doesn't sit right. So the joint obviously isn't working properly. So again, I've lived with it for 9 months, and I've just now decided to do the surgery. So I'm scheduled for tomorrow. Well, not just now decided, but in the last couple of months, I decided, despite not having too many problems with it and being able to do everything I want, the discomfort, wearing backpacks, having a bone sticking out, it's uncomfortable wearing backpacks. It's uncomfortable sleeping. I like to sleep on this side. I'm a side sleeper. So I really can only sleep on one side now or on my back. I've learned to sleep. So anyway, because of the discomfort and the disfigurement, I did decide to go through a surgery. It's going to be done by Michael Banfi at the Kerlan Jobe Orthopedic Clinic in LA. They have offices down here in Anaheim, so I've been meeting with him. Surgery is tomorrow morning in Los Angeles. So I want to get a video of before surgery, and then I'll do a video or two afterwards and kind of talk about how it went. The plan is, it's mostly arthroscopic, but they need to make an incision to view what they're doing from behind. So there will be a small incision at the top or kind of in the back to view it, and then it'll be done arthroscopically. They're using fiber tape and cadaver ligament graft. So they're going to drill one hole in the clavicle, suture it through, connect it down, bring it back up and over to the side. So actually the fibers are going to be going up and down. It's going to come over to the side, and the way it wraps around and cinches back in, it's actually going to do somewhat of a band or repair at the AC joint, which it's not, the AC joint itself is not going to be repaired, but it sounds like there will be some reinforcement between the fiber tape and the actual graft. And then there's going to be about 7 millimeters of the clavicle that's going to be cut off. That's probably going to be quite painful during recovery, but that's necessary to skeletize it, and they'll be cleaning that area. They basically going down to the bone so they can do it properly and suture everything up, and then hopefully it's probably going to be a week or so of pretty bad pain. He does say it's only going to be about 2 days until the major bandage comes off and I can replace it with a Band-Aid and start cleaning the area. So that's good news to me. He thinks within a week I should be out in the clear in terms of pain. I expressed concern about the nerve blocker, and he says, 12 to 24 hours that should be gone, so I should be able to start, I don't know, moving a little bit. Obviously, the arm itself is going to be in a really tight sling, and that's not going to come off for several days. But I was a little concerned about the nerve blocker also affecting my neck or my right arm. So obviously, if I can't move any of that area, I'm going to be totally disabled. My dad and stepmom will be around to help out. They'll be looking after me. I'm getting a hotel tonight next to the hospital and probably stay there one extra night and then hopefully come home. And I'll have folks around me, and I don't know, knock on wood. So I think that's all I can say for now, talking about kind of my apprehensions going into it, but deciding it's something that I want to do and the reasons for why I want to do it. And then after the surgery, hopefully it goes great. I've been talking with another YouTuber, Adam, and he did express concerns. He hasn't done the surgery, and he expressed concerns, it can get infected. You could stretch out, like maybe you're half asleep and you stretch and you actually break or tear what the surgeon has repaired. So I'll have to be careful about things like that, keep my arm in the sling until it's recovered. And then I'll probably talk about my physical therapy, and how I'm going to get it back to full flexibility, range of motion, and strength, and then hopefully it looks a lot better. The surgeon's very optimistic. He says other than the small scar, should be 100%. So knock on wood, and I'll be checking back in and hoping it goes well.